that you have been successfully doing.
Can you see the screen?
Yes, it's perfect.
All righty. Good morning, everybody. Welcome to Cup of Joe with Zoe. That is so cool. I thought that was so neat. um, First of all, I want to, again, my name is Tony Toomer. I'm the State Opioid Treatment Authority and the Opioid Treatment Program Manager. I've been here for a while, and I am happy to be here to just talk to you guys about OTPs. First, I want to give you a little bit of history of the OTPs. I started in 1994, and when I started, there were only 12 OTPs in the state of Indiana. Um, and in 2008, we got 13 OTPs. That was Porter Stark in Valparaiso. If you notice the ones here in red, those are the ones that are connected to a community mental health center. I just want to let you guys know that. So in 2008, Porter Stark opened there's in Valparaiso. And in 2017, legislation allowed for 5 additional OTPs. In 2018, Medicaid actually started reimbursing for these services. So in 2019, we were able to open up the 5 new OTPs. One was in Bloomington, one was in Greenwood. The one you talked about, Zoe, was in Lafayette. Zoe was very instrumental in opening that one. The one in Fort Wayne was opened by Bowen Center, and the one in Terre Haute was opened by Hamilton Center. So in 2019, again, legislation allowed for additional 9 new OTPs. So in 2023, we reached 25 OTPs. Indianapolis opened one. LaPorte, Porter Stark again opened one in LaPorte. Martinsville, Muncie, and then Plainfield. Hamilton Center opened another one in Plainfield, Seymour, and then Vincennes. And then in 2024, we opened one in Kokomo. So now we have a total of 26 OTPs. So since 1994, we have doubled the number of OTPs in the state of Indiana, which is a great thing. So just so we can understand, federally regulations. We are regulated by 2 federal agencies. One is SAMHSA, Substance Abuse and Mental Health Services Administration, and the other one is DEA, the Drug Enforcement Agency. SAMHSA is an agency within the U.S. Department of Health and Human Services and regulates the public health aspects of OTP operations. And the DEA is responsible for program security, and it's agency within the U.S. Department of Justice. And then we have state regulations. All OTPs must meet DMHA certification standard, which is Indiana Administrative Code. They have an annual application recertification requirement. They must comply with state and federal laws, which is SAMHSA DEA and the Indiana Board of Pharmacy. They must be accredited by a recognized national body like JACO or CARF. And then they have to make sure they have followed the licensing and inspection in accordance with local codes. And then every patient must be part of the central registry. And I know a lot of you know there's been a lot of changes coming with the federal government, with the state government. So those are the things that I want to cover with you real quick today, was about a lot of those changes that are going on. On the federal level, before the Senate Bill 43 came out, the federal government had already made a lot of changes. And the ones that really that were affecting us, or that we really had something to do with, was the stability criteria for methadone take homes. And this one was the state had certain criteria that you had to meet for these safe take home medication. The federal government, they gave more of that authority to the medical directors to decide about the stability, who was stable in order to receive take home medication. And another one was the time and treatment for methadone take homes. The federal government was decided to allow up to 7 days worth of take home medication in the first 1 to 14 days. And of course, the state of Indiana has always been more stricter than the federal government, and we did not comply with this. You still have to have time and treatment for methadone take home. Another change was the initial dosage. Your initial dose for methadone used to be 30 milligrams, but due to a lot of the newer drugs coming out, fentanyl, xylazine, it takes more to dose the patient. So the federal government has allowed the initial dose to go from 30 milligrams to 50 milligrams. Okay. And they also have allowed what we call split dosing. Now, split dosing, as far as the state is concerned, is only done at certain levels, and it was only being done for pregnant women. But the federal government has allowed, said that split dosing is available anywhere. And so we haven't actually opened it up in our rules or anything, but we are having discussion about who can split dose. Right now, we are letting the medical directors make those decisions, and that we talk about it before they do it. But we still allow for pregnant women, but we are seeing that it is being used in many more different situations. And so we are having those discussions here at DMHA. Another one is guest dosing. We had also, the state had put limits to who could guest dose, where you can guest dose, the reason for guest dosing. The federal government has opened that up and says circumstances include but are not limited to travel for work, family events, temporary relocation, or OTP's temporary closures. Guest dosing, we have allowed guest dosing in certain situations, and we will continue to allow guest dosing in our certain situations. So those are some of the federal changes. Um, Senate Enrolled Act 473 is law now, and these are some of the changes that will be coming to effect July 1 of this year. Um, Sunday and federal holidays, OTPs will be allowed to close on Sunday and federal holidays. Now, they don't have to, but they can. And now, monthly urine drug screens. This situation was when a patient tested positive for a drug, um, they had to do weekly drug screens until they became illicit. Now, rule says once if they test positive for a drug that is not on the treatment plan, they don't have to do weekly drug screens anymore. It's monthly. Um, and we also used to require all our medical directors to have a admitting privileges at our local hospitals. And for a long time, this was never a big situation. Then Medicaid started paying for the services, and the hospitals started wanting the doctors to actually put in some hours at the clinic. So Senate Enrolled Act 473 no longer requires admitting privileges for medical directors. Another thing that changed, authorized healthcare providers, i.e., advanced practice registered nurses or physician assistants, can now do the things that the medical director were doing. So we have allowed that will allow for more intakes and a smoother transition into the OTP. Another change that has came up is the use of audiovisual telehealth for intakes. OTPs will now be allowed to do intakes via telehealth. And another thing that changed was, again, if I mentioned earlier, the state of Indiana has always been more stricter than the federal government when it comes to OTPs. And so, what the Senate Enrolled Act does now says that the state of Indiana may not be more stringent than 42 CFR 8.2 regarding patient admission and administering or dispensing of initial dose. And that kind of coincides with us going from 30 to 50 milligrams. And patient admission is another one that allows more of the authority has been put into the medical director when it comes to patient admissions. Now, when it comes to um, whole person centered care, this comes into where the opioid treatment program services, we do intakes, treatment plans, behavioral therapy, clinic, case management, substance abuse monitoring, self-help, continuing server care. Those are the things that we offer in the OTP. But when people come into services at the OTP, they might need mental health services. medical services, educational, HIV/AIDS services, legal, financial, housing, family, childcare. Those are the things that we try to partnership and collaborate with our community mental health centers to see if we can, how do we provide these services to the people? And like I said, we provide the services on the left. Possibly services needed by consumers are on the right. And what we really would like to do is have these partnerships and these collaborations with other outside organizations, including community mental health centers, the courts, probation. How do we provide these other services to these people? How do we provide referrals? How do we get them into it? Because one of the things that we are seeing is that people don't go from service to service. We give them a referral to go to a community mental health center or somewhere else. More than likely, they're not going to make it. So we really like to give warm handoffs. You know, call that person and talk to that person and collaborate with that person and have that partnership. So when these situations do come up, we have a partnership and referrals and places to go to the people. Um, and that was it. But you gave out my information earlier, so there you go. I'll stop sharing and I will take questions.
What questions do people have for Tony?
Good morning, Tony. It's Beth Keaty down at LifeSpring. One question that I would have is, how would you suggest we go about maybe formalizing those relationships, especially around care coordination of mutually served patients?
I would actually reach out to the program director of the OTP that you're trying to get in touch with and set up a meeting with them to try to discuss all these topics of how the partnership, how to collaborate. Because what needs to be done is they need to understand your services, how you operate, and it would be good for you to understand their services and how they operate. If you guys could get together and set up some type of lunch and learn series between the OTP and the Community Mental Health Center, that would be great. And if you need assistance with that, just reach out to me or anybody on my team, and we will help you guys set that up.
Tony, I also know, and I don't know if people are still doing this, I'm going back to the days that I worked on that with you. I also know a lot of the OTPs have like MOUs for care coordination with the community mental health centers. Is that still the case too, that you could work with them on that care coordination through like an MOU agreement?
That's what we would like. We would love
Okay.
to see those MOU agreements being updated, being used, because again, before situations happen, if we got a plan to operate and to execute, would be great. Because we want, like I said, we encourage the partnerships and collaborations.
Great. What other questions?
Hey, Tony, can you talk a little bit about reimbursement or the support from the state in regards to this programming?
To OTPs?
Yes, yes.
Well, Medicaid now offers a weekly bundled rate
Okay.
for our opioid treatment care. So our patients, that has tore down the barriers and challenges of getting into services. There, right now, the biggest issue in our OTPs is transportation. But we are working on that here at DMHA also. Transportation, trying to ensure that patients have transportation to some of these services. But yeah, does that answer your question?
It does, and I do remember a long time ago at Greenwood with Valley Vista, there was startup dollars. Is there anything like that anymore to help with those programs too?
No, we don't have Starbucks dollars anymore. And when you say that, what type of services are we talking about?
If we would have a type of clinic where we could provide MAT services specifically as an OTP, just starting that clinic up just for furnishing it and those kind of things.
You can't start up an OTP. You can start up an OBOT.
Okay, sorry.
And that way you can only do buprenorphine and Suboxone. You have to be certified. You have to have a license to do an OTP. Okay. And we're not giving out any more licenses at the moment.
Okay, good to know.
So the best bet would be to offer MAT services or for the buprenorphine and Suboxone, and then have an MOU with an OTP for the methadone. Okay. Or you could just have an MOU with an OTP to dispense the methadone, the buprenorphine, and the Suboxone. That way you wouldn't have to do it yourself. You just have that OTP, that MOU with that OTP.
So we have MAT services now, and again, I'm just maybe getting in the weeds a little bit too much, but because it's a therapist and a licensed provider that provides the service, we bill that underneath the FQHC. I don't know that it would be beneficial for us to look at partnerships, but we have quite a few MATS clinics and quite a few providers that are providing that service. Have you had anybody ask you
Are
about
they? Do they have any? Are any of those patients on methadone?
No, actually, we do Suboxone, Vivitrol, Sublocade. Those we have not went down the route of methadone.
And see, the only referral that you would need would be for the methadone. And if you had a patient that wanted to be on methadone, that's
Okay.
when you would have that MOU
Okay.
with that OTP. Because
Okay.
right now you're providing all the MAT services except the methadone.
Exactly. Exactly.
So
Okay.
if you had a patient that wanted to do methadone, you would just have that MOU with that OTP for those services.
Thank you. Thank you.
Questions? What other questions? And I did notice that the lovely Kelly Welker is also on. That's part of Tony's team. So Kelly, I don't know if you want to just come off mute and introduce yourself real quick too, just because it'd be great for people to know who you are.
Good morning. This is what I get for going on camera, though. No, good morning, everybody. I'm Kelly Welker. I am the Director of Addiction and Prevention Services here at DMHA, and the OTP team is part of our overall team here. So happy to be here, and Tony did a great job, and thank you for the great questions, too.
Absolutely. Any other questions for Tony?
I do have a question. This is Dr. Sheikh. Can you give us some insight how Indiana OTPs are doing compared to other OTPs in other states within Midwest?
Well, I might be a little bit biased when, when I say this, but in my opinion, I think Indiana is on top of the game. And let me give, for instance, when COVID hit and we had to figure out a way to just get people their medication and also keeping them out of the clinic, we did such a good job. We had other states calling, asking us how we were doing this. And so when it comes to Indiana, we're on top of our OTPs. A lot of states don't even have regulation over their OTPs, which I was shocked at. And a lot of states have a lot more OTPs and less regulation. And like I said earlier during the presentation, Indiana is one of the top 5 most strictest states when it comes to OTP. So the partnerships and the collaborations that we have created with our OTPs, even though we regulate them, we come to the table as a team. We try to work as a team with the OTPs, and that just works out so much better for us. We have medical directors meetings. We have quarterly meetings where we all meet in person. So we are always talking and discussing the latest trends, what's coming up, the barriers, the challenges. So in Indiana, I think we do a great job because we are always discussing what's going on and trying to stay ahead of things.
It's good to know. Thank you.
Any other questions? I guess, Tony, Kelly, you have about 60 CMHC partners on. Do you have any questions for them too?
I do. And I would like to know, are there any barriers or challenges from CMHCs reaching out to OTPs? What is the biggest barrier, the challenge of them, of not having that partnership in those relationships?
Great question.
I can just speak to the challenge of creating a partnership. And we've been fortunate that on a day-to-day basis, we work really well with Southern Indiana Comprehensive Treatment Center. But as a large company, it's very difficult to get anything formalized and in writing because it has to go through many levels and layers and states to get anything done. But I think on a day-to-day basis, we work pretty well with them.
Any other thoughts? See,
I
lots
just
of
want
people.
to, oh, sorry. I was going to say, I just wanted to offer up what Tony had offered up before. If there is anything that we can do to help assist to get that collaboration or those connections, we're more than happy. And I'm speaking for Tony when I say we are more than happy. Tony and his team are more than happy to make those email connections with those OTPs that are in your areas of your CMHC. So please do not hesitate to reach out to us.
Yes, I just want to back that up what Kelly just said. We are more than happy to start those conversations. If you are a community mental health center and you are just unsure about what to do or how to do or who to contact, call me or somebody on my team and we will literally set it up and we will help and assist with meetings, setting up the conversation, starting the conversation. We are all in. So we will be there because like I said, we try to work as a team with our OTP. So as a team, we should be able to cover these things. And we want OTPs, we want community providers, not just community mental health centers, all community providers, residential facilities, courts, probation. We want partnerships and collaboration with all of those because our consumers are the same consumers. They just touch different bases. And we would like to bring it in because we are realizing that when it's wider and they have to go to many different places, they fall off. So if we can keep them as close as possible with these partnerships, these referrals, and when I say referrals, I don't mean just telling them to go somewhere. I mean giving them a name, making a phone call, introducing them to their next person where you want to refer them to. So it's about communication and partnerships. So we are definitely open to helping and assisting in any way we can.
I speak, I've witnessed that firsthand with Tony. If you want to know a collaborator, a person who brings people together, he does an absolute phenomenal job with that. So please reach out if you would like to make those connections or if you are having any issues in your areas. Having a loved one who needed care in an OTP and then did the work at the community mental health center, that collaboration is really important. And so I'm just really grateful for the work, Tony. That is really cool to see how policy has impacted OTP growth and in that time of your career. And so, since that's the council's North Star is mental health and substance use policy, I just really commend you for those efforts. So you have the contact information. The presentation will be up. If we can all take a moment to thank Tony and Kelly, and then I am going to just wrap up with a few quick things for all of you as well. So thank you, Tony. And then I will start sharing my screen. So just a reminder, if you have not yet